chronic kidney disease and acute kidney disease or kidney failure. Acute kidney disease occurs as a result of factors that can be controlled and can be restored. But with chronic, most of them normally end up to chronic kidney failure, the end stage kidney disease, where that your kidney function can no longer be restored, leaving you with two options. Either go with dialysis for the rest of your life, or you do a kidney transplant, which can be successful or at times may not be successful and is also very, very expensive. So it is important you start as early as now to ensure that you prevent yourself from developing kidney problem. Check your kidneys. And here I want to give you some of the tests that you can check regularly just to ensure that your kidneys are functioning properly. Test number 1 of the kidney function test, we have what we call the creatinine test. Creatinine is a byproduct of muscle metabolism, and it is filtered out from your system by your kidney. So it is normally within a certain normal range within your blood. If it exceeds that normal range, then we say that you have started developing kidney problem or kidney failure based on that. Your kidney function is normally measured with what we call the creatinine. Creatinine is one of the variables that we use to calculate your EGFR, estimated glomerular filtration rate, the EGFR. That is what we use to monitor the function of your kidney, and that function should normally be above 90. Anything above 90 is considered normal. If it drops below 90, maybe say from 60 to 90, it appears normal but has some questions as well. If it gets below 60, then you have already started developing kidney failure. If it drops below 15%, then you are at end stage and your kidney are now dead and cannot perform their function. They have now collapsed and they can no longer function. So checking for your creatinine levels, checking for your EGFR levels, checking for your blood urea, checking for your electrolytes, checking for presence of protein in your urine are some of the common tests that you can walk into that hospital to know whether your kidneys are still functional or have started failing. Starting as early as today is the only way that you are going to help yourself. Starting as early as now is only the best solution that you can do to prevent you from developing kidney disease. Controlling conditions such as diabetes and hypertension are some of the major tests to ensure that you don't develop a kidney problem. Monitoring what you eat, eating healthy, and having all the healthy habits is some of the major steps in ensuring that you don't develop a kidney problem. There are some early signs that you might be developing a kidney problem. One of them includes urinating very frequently. Urinate very frequently but produce very little urine. It means that your kidneys are no longer functioning well. We have things like sweating, swelling within your feet, within your ankles, within your face, due to some fluid buildups or the wastes that should be removed by your kidney cannot be removed and they end up building up within your system, leading to the swelling. We have frequent thirst, fatigue, loss of appetite. Such kind of things are some of the early warning signs that you might be developing a kidney problem. But the only way that you are going to rule out that is by going for checkup. Don't wait until you get sick. Is when you visit that hospital to check whether your system is okay. Because the moment those signs show up, then it means you are in the danger zone and you might end up in management for almost the rest of your life. Start early, do checkups early, do early screenings to ensure that we reduce the number of chronic kidney disease patients in our society today. Visit any hospital, do simple tests like urinalysis to start with. Check for the presence of proteins in your urine, because those are some of the routine tests that you can get in your nearby facility or health center near you. Can start with that. You can make a habit of doing a kidney function test at least once a year, just to check for your kidney function if they're still within the recommended ranges. Ensure that you live a healthy lifestyle. You avoid substances that toxicate your system, substances that add more toxins to your system than nutrients to your system. Let's help each other in preventing and reducing the rise in the number of chronic kidney disease patients in our society today by being responsible first to ourselves, by monitoring our system regularly, by doing regular checkups to ourselves, by living a healthy lifestyle. Thank you and keep following for more.